Hey everyone, welcome back to our channel. Today we're diving into a topic that often flies under the radar but affects millions of people every year, acute bronchitis. So what exactly is it? And why should we care? Let's break it down. Acute bronchitis is a common respiratory condition that is characterized by inflammation of the bronchial tubes. The condition is usually caused by a viral infection such as the flu or common cold, and can also be triggered by bacterial infections or irritants like smoke, dust, or fumes. Acute bronchitis typically lasts for a few weeks and is usually self-limiting, although it can cause discomfort and disrupt daily activities. Acute bronchitis is an inflammation of the bronchial tubes which carry air to and from your lungs. It's usually caused by a viral infection, often following a cold or flu. But here's a question for you. Why do some people develop bronchitis while others don't? Is it just luck, or are there underlying factors at play? Symptoms of acute bronchitis include coughing, which may produce mucus, chest discomfort, wheezing, shortness of breath, and fatigue. These symptoms can be quite similar to those of a common cold or influenza, so it's important to seek medical advice if you experience persistent or severe symptoms. Now, you might be wondering more about the symptoms. Well, it typically starts with a persistent cough, sometimes producing mucus, chest discomfort, fatigue, and even a slight fever. But here's the kicker. Many people confuse it with a simple cold. So how do you know when it's time to see a doctor? Treatment for acute bronchitis primarily focuses on relieving symptoms and supporting the body's natural healing process. This may involve over-the-counter medications such as cough suppressants, expectorants, or pain relievers, as well as plenty of rest and hydration. In some cases, a healthcare provider may prescribe antibiotics if a bacterial infection is suspected, although this is not always necessary. And here's a controversial point: antibiotics. Many folks think they're the go-to solution for bronchitis. But did you know that acute bronchitis is usually viral? That means antibiotics won't help. This leads to a bigger question: are we overprescribing antibiotics in our society? In addition to medical treatment, there are several strategies that can help prevent and manage acute bronchitis at home. Here are some practical tips for dealing with the condition. 1. Stay hydrated. Drinking plenty of fluids can help thin mucus and make it easier to cough up, reducing congestion and discomfort. 2. Rest. Resting and allowing your body to recover is essential for fighting off the infection and preventing complications. 3. Use a humidifier. Adding moisture to the air can help loosen mucus and relieve coughing. 4. Avoid irritants. Limit exposure to smoke, dust, and other irritants that can worsen bronchial inflammation. 5. Practice good hygiene. Wash your hands frequently to prevent the spread of viruses and bacteria that can cause bronchitis. Now let's talk trends. With the rise of air pollution and smoking, acute bronchitis cases seem to be on the rise. Is our environment making us more susceptible? And what about the impact of COVID-19? Some studies suggest that respiratory infections have surged since the pandemic began. Are we seeing a new wave of bronchitis cases? By following these tips and seeking appropriate medical care when needed, you can effectively manage acute bronchitis and minimize its impact on your daily life. Remember to listen to your body, rest when needed, and prioritize your health to help your body heal and recover from this common respiratory condition. So, what can you do to protect yourself? Staying hydrated, avoiding irritants, and practicing good hygiene can go a long way. But what about natural remedies? Are they effective? We'd love to hear your thoughts in the comments below. It's important to note that while acute bronchitis is usually a mild and self-limiting condition, it can sometimes lead to complications such as pneumonia in vulnerable individuals. If you have underlying health conditions or if your symptoms persist or worsen, it's important to consult a healthcare provider for an accurate diagnosis and appropriate treatment. In conclusion, acute bronchitis is a common respiratory condition that can cause discomfort and disrupt daily activities. By understanding the causes, symptoms, treatment options, and prevention strategies for acute bronchitis, you can empower yourself to recognize and address the condition effectively. Remember to take care of yourself, seek medical advice when needed, and prioritize your health to support your body's healing process and recover from acute bronchitis successfully. Thanks for tuning in today. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more health insights. Until next time, stay healthy and curious.